Welcome to the Pharmacy Marketing Simplified podcast, part of the Pharmacy Podcast Network. Pharmacy Marketing Simplified focuses on easy and proven marketing tips from pharmacy owners and industry experts to leverage in your independent pharmacy business. This podcast is all about pharmacy marketing and how to be successful in today's competitive marketplace.
This is Nicolle McClure, President of GRX Marketing and host of the Pharmacy Marketing Simplified podcast, which is part of the Pharmacy Podcast Network. Today, we are bringing you a special podcast series in conjunction with Cardinal Health. I'm thrilled to be speaking to today's guest, Betsy Walker, who is the Director of Community Relations at Cardinal Health, and she will be discussing the Generation RX program. Betsy, welcome to the show.
Hi, thank you, Nicolle.
Before we get started talking about the program, can you tell our listeners a little bit about yourself and your connection with helping pharmacy owners?
Sure. So I have been with Cardinal Health for 14 years in a variety of different roles. I actually used to work directly with retail independent pharmacists years ago when I was in the independent sales organization. But for the last 5.5 years, I've been in our community relations team. And my main focus is on our Generation RX program. So Cardinal Health and our philanthropic work and within the Cardinal Health Foundation, a significant part of what we focus on is the public health issue of prescription drug misuse. Mm-hmm. So starting in 2009, we began partnering with the Ohio State University College of Pharmacy on Generation RX. And together in partnership with Ohio State and many others, we bring about prevention education and a really strong community focus on engaging all community members around medication safety and teaching them about prescription drug misuse prevention. So the retail independent pharmacists have been our number one ally in terms of taking the Generation RX education and connecting it back into their communities. So they have been the very best champions or advocates, ambassadors, whatever you want to call it, across the country, really since 2009 when Cardinal Health Foundation began partnering on the program and taking it to a national level. And so the retail independent pharmacists, we've always believed are, they're the most accessible healthcare professionals, and obviously medication safety is such a critical topic for them to be discussing and such expertise in their area. It's a very natural fit for retail independent pharmacists to bring this medication safety education not only to their patients, but into the community as well. And
I'm familiar with Generation RX, and I think one component of it that I've always liked is trying to reach the younger kids.
Yes.
I know you guys offer service or a program about for elementary school kids mm-hmm. and middle school and high school students, and that message varies a little depending on the age group, but overall the same of why it's important to not abuse drugs. Mm-hmm. I guess can you touch on a little bit, why is it important to try to talk to that younger demographic instead of waiting until you're an adult and you're taking medications?
Absolutely. And I'm so glad to hear that you think that the education for the elementary school and the younger kids is important. That's why we created the education, is because there was a need. So we focus on from elementary school students to older adults and everyone in between. And the main reason we want education to be at such a young audience is that medication is in all of our homes. Mm-hmm. So Generation RX is about medication safety, safe medication practices for life, and focusing on preventing misuse. So for elementary school students, for younger students, it's really introducing them to what medicine is. We talk about what a pharmacist does. We talk about what a doctor does and how the two work together. So what is a prescription? These children have medication in their home in some way, shape, or form, whether it be a prescription or an over-the-counter or a vitamin. And so it's really introducing them to the concept of it and around safety and very key topics or key messages around only taking medicine from a trusted adult. So a child should not be taking medicine by themselves. And so the medicine is in the home. And we thought it was really important to focus the education around medication safety. So for the younger audience, for elementary school students, it's all learning through games and activities. Mm-hmm. It's very hands-on. It's meant to be for small group sessions. That's really the intended audience for all of Generation RX. It's not ideal format for a large auditorium type of setting because it's interactive learning through games and activities. And so In small groups, they're learning about, what is medication safety? What does a pharmacist do? What does a prescription label look like? They're actually using basic mathematics to work through some simple addition and subtraction and multiplication and whatnot, things that a pharmacist would do when trying to dispense a prescription and reading the label. They are learning about the difference between candy versus medicine, which oftentimes look very similar. And they're just learning about how important it is to have a trusted adult and to only take medication under the supervision of a trusted adult. So the basis of the education at that age, it's not focused on misuse conversation.
Mm-hmm.
There's no conversation around prescription drug misuse or addiction or dependency. It's really around introducing them to medication safety.
Which is a great approach, I think, because otherwise that type of messaging would probably just, at that younger level go over their head. So
yes. Yep.
Do you have any results that you can share with us that you've seen over the last couple of years since doing the program?
Yeah, we know very conservatively that we have directly educated using the Generation Rx resources over 1 million Americans. We know it's in every state in the country. We know that the resources, actually very much thanks to the retail independent pharmacists, they're used in every state in the country. And so through post-test evaluations, so after students and adults have been through the education, whether it be a one-time or multiple education touch points with Generation RX, they're letting us know about their knowledge change. So what have they learned about medication safety? And how is that going to change their behavior? What is their intent to change behavior? And so those results are pretty incredible. They're, mid to high 90% of, 95% of younger children, or I don't have the exact statistics in front of me right now, but it's very high percentage of, they have learned things about not sharing medication. They have learned to ask for permission for younger students or whatnot. And then for those that would have a behavior with medication, their intent to change their behavior after they've learned about proper medication safety. All of those results have been very positive.
Awesome. So, if a lot of independent pharmacy owners listening to the podcast and, maybe they've heard about Generation RX, but, haven't taken that step to get involved, what would you say to them? Why is it important to be involved in the program? Not only that as well, but also doing like drug take back days and things like that. Yeah,
absolutely. So, the retail independent pharmacist is the perfectly positioned community business owner to engage in community education. One, they are already the medication safety experts, so it's in their wheelhouse to talk about this topic. Two, they have the physical location within their community for people to interact with them on a daily basis. They have, they're the most accessible healthcare provider. And so why not include that education when they're engaging with patients? Even if a patient's not coming in to pick up a prescription, maybe they have signage or they have education awareness information throughout their store. So even if somebody's coming to pick up, a pack of gum or a snack or something from their store or an OTC, they're still going to receive that education. And then these are leaders in their business. They're leaders in their community. And so they're very much respected. There's such a need for more pharmacists to be involved in community issues where healthcare expert is needed, in addition to physicians and the medical profession. Pharmacists should be there too. So I think Generation RX is a very natural fit for retail independent pharmacies. We have tried over the years in the creation of the content and rolling out the different educational toolkits and resources to have it all created for someone. So someone like a pharmacist who's owning their own store, oftentimes the main pharmacist behind the bench, they don't have the time to create the education themselves.
Right. Yeah.
So we have spent countless hours doing the research and the focus groups of what is the audience, a certain age group need for that. That is where our partnership with the Ohio State University College of Pharmacy comes in. So the pharmacy professors in the college are Generation RX partners there. They're the ones creating the content for it from their expertise as pharmacists and medication safety experts. So then together, the pharmacist can just pick up the resources and go. They don't need to create the presentations. They don't need to create the content. content themselves. We have all of the speaking notes for each of the PowerPoint presentations, for each of the games and activities. So we have a full facilitator guide of exactly how to conduct the activities based upon the age. If someone has 15 minutes, then we say, here's what you can do in 15 minutes. If someone has 30 or 45 or an hour long opportunity, here's what we would recommend. So we try to take the work out of the hand of the pharmacist and just make it easy for them to pick up the resource and go. And so I think with the very busy lives that retail independent pharmacists lead, it's a really nice resource for them to use. And of course, it's all free. Everything that comes out of Generation RX is free and strongly recommended for anyone to use. So
yeah, and I've my parent company, we own pharmacies ourselves, and we've used the Generation RX materials.
Awesome.
And yeah, I think I've always been really impressed about the stuff that you guys put together.
Thank you.
Great information, but also to be able to distinguish it for those different age groups.
Yeah.
I think is very important. And like, you touched on, I think a lot of pharmacists want to do it, but it's just that barrier of time and a little bit overwhelming to have to know to put those materials together. But since you guys provide all that, I think that's a great thing. So,
well, and you mentioned time. So even if the resources are available, we know that there's still going to be that barrier of time that it's hard for pharmacists to get away, especially those that are owner operators. And so I would encourage partnerships. I would encourage collaboration. One partner that has always been really helpful is student pharmacists. So if you have a college of pharmacy, if a retail independent is a preceptor for some of the students nearby, we actually have a wonderful partnership with the American Pharmacists Association through the Academy of Student Pharmacists. So each college of pharmacy has what they call the APHA ASP chapter at all of the colleges of pharmacy across the country. And we have partnered with APHA ASP since 2010 on having each of the colleges of pharmacy have a Generation RX program. So we have over 118 colleges of pharmacy across the country that have a Generation RX chapter. That is an army of student pharmacists that are spread out across the country. Many of them are very close to pharmacies, retail independent pharmacies or other community pharmacies, and they would love to help. They're already doing those partnerships either on their campus or with other pharmacy locations. And so I think that's a very easy connection. Students are very driven. They're very creative. They have more time. They work for free. So there's just like
all the great
there's wonderful benefits, shout out to all the student pharmacists that might be listening. And they have been doing fantastic work with Generation RX for years. So I would encourage, if there's a practicing pharmacist that would love to get involved but isn't able to kind of shoulder it all. The other great thing about Generation RX is that it's not just for the pharmacy community. Generation RX is a community outreach tool that's used across the country in many other audiences. For example, we have a significant amount of our education being used in schools right now, K through 12 schools, and it's used by teachers or by prevention specialists from the local community substance use prevention organizations or community coalition. So if you have a staff member or if you have a family member that's passionate about this topic, if you even have a high school student, high school child or an employee, this is something that they can take and run with it as well. It's intended to be very simple education, and it's intended to be easy for someone to present. You certainly don't have to be a pharmacist, but they can do it in partnership with your pharmacy. So it could be, Joe's Main Street Pharmacy coming into the local schools to present Generation RX, and the pharmacy owner, operator could have a big role in that, but doesn't have to be present all the time to actually coordinate all of the presentations and all the connections into the community. Okay,
great. And again, I think that just is one more barrier taken down for some pharmacy owners out there that, or haven't started the program yet, but want to. And from a marketing standpoint, I think it helps distinguish you from your maybe some other competitors out there, but also shows that community involvement and kind of goes back to the core of, what an independent pharmacy is. So, you had mentioned community collaboration. Yeah. There could be other groups within the community that the pharmacists could partner with to help bring this message to their local community.
There absolutely is. And we have found that there's never enough prevention.
Mm-hmm.
So when a community is looking at addressing the opioid epidemic, they're going to look at it from multiple sectors. There are multiple parts and factors of the issue. They're going to look at it from prevention, yes, but they're also going to look at it from intervention. So use of naloxone, for example, or the access to treatment and getting people into treatment, and some of the barriers, and trying to resolve some of those barriers around access to treatment and getting people there in enough access to treatment, and then recovery. So there's so many different pieces and parts to it that a community is going to be very engaged in. The role of the pharmacist can span across all of that, the entire continuum. But the role of prevention, I think, is such a natural fit for the pharmacist. The pharmacist is always going to be thinking about the wellness of their patients. It's not just about filling a prescription to address a chronic disease. Mm-hmm. They're trying to get that person healthier in order to reduce the amount of health issues in their lives. They're trying to work on their wellness from upstream. And so that's really what I would say is a similarity with Generation Rx, is that we're trying to prevent misuse from happening in the first place. And so I think there's a very natural fit for pharmacists to do that. There's always an opportunity to have more prevention, more substance use prevention in communities, not just on prescription medications, but on all substances. And so I think when you have an interested pharmacist, when you have someone that's passionate, when they have a solution that's ready to go and something that they can interact with and engage with multiple audiences, it's going to be well received. Mm-hmm. So that's really our hope, is that Generation Rx would be a tool that would be useful in communities across the country in bringing that important prevention message to communities.
Okay. So a listener is ready to get started and wants to get engaged in the program, where would they go to kind of take that next step?
It's their first stop is going to be the website, generationrx.org. So when they go to generationrx.org, they're going to see several options for just education. They can start on about the issue. There is an area about the role of the pharmacy community, which talks about that. There's a video focused on some of the great work that the pharmacists have been doing on Generation Rx over the years. But the content, the main body of content on generationrx.org, where this education is under the toolkits section. So if you just go to generationrx.org, click on toolkits, then you're going to see all that education broken out by age. And then I would just start small. So think about, which audience are you interested in working with? Is it elementary school students? And if it's elementary school students, that's great. Is there one school or even one grade within that school that you could start with? So start small, start manageable, take a look at the education for one group. There is a lot of information on the website. There's a lot of pieces and parts to each of the toolkits. And so just kind of taking a bite of something that's manageable, given the rest of the responsibilities that the pharmacists have in their lives and the community members have, and just start from there.
Okay, great.
So, yeah.
Anything else you want to add? You want to tell our listeners about Generation Rx?
No, there's so much, but just thank you. Thank you to the pharmacy community for your commitment to preventing prescription drug misuse. We know that Generation Rx and the idea of education outreach is just one of many, many things that a pharmacist does to think about how they can play a role in reducing prescription drug misuse, reducing the opioid epidemic. There's so many things that they're doing behind the counter clinically and in partnership with prescribers and in partnership with their patients. We appreciate that Generation Rx is one of the additional ways to help that pharmacists have found themselves to be doing. And we just say thank you, and please let us know how we can further help.
All right. Yeah. Well, thank you for joining me today. I really appreciate your time and all the valuable information on Generation Rx.
Thank you.
Again, this is Nicolle McClure with the Pharmacy Podcast Network, bringing you a special series with Cardinal Health. You can check out all the podcasts at pharmacypodcast.com.
You were listening to the Pharmacy Podcast Network's leading marketing podcast, Pharmacy Marketing Simplified, sponsored by the proven leader in pharmacy business development and support, GRX Marketing. For more proven strategies and ideas on marketing your pharmacy business, check out grxmarketing.com.